what you learned new?
The new way of ACL graft from the quadriceps tendon. This is the first time I saw. You have a good experience. Fastest way.
Fastest way of doing ACL, right?
Yeah,
We are very quick.
Yes.
Meniscus, you guys will do a lot of surgeries, yes.
And meniscus. So
Have you seen the blood clot and everything?
yes.
So what you are gonna do after you go back? The quadriceps is sometimes not available in all the countries, but it is available.
I think the Arthrix
Is there.
company is there,
It's cartilage.
and I think in the ACL graft taker.
Yeah.
I think it's
Yes,
provided there.
it's provided there,
I
definitely.
want to ask the
The Arthrix
company.
guy. And second thing, what you are gonna change in your practice in ACL? LET?
LET. Yeah.
LET is very important. You have to do LET in all the cases.
Yes, this is the first time I saw.
Yes, LET is very important. ALL reconstruction. And what about cartilage transplant? Have you seen cartilage
Yeah,
transplant?
I saw it. The cartilage transmission and osteoarthritis or cracks of articular surface.
Yeah.
You have an excellent experience.
Autocard, graft net, HA membrane with the oats.
You are a nice doctor, and I hope to have a university, okay, to learn the people, to learn the doctor about ACL. I think in future you have a good chance, I think. And the shoulder, so you have a good experience.
We did, you saw Bankart repair?
Yes.
Bankart repair.
And the ankle.
You saw the ATFL?
Yes,
Internal brace, right? These are the rare surgeries. Even in India, it is very rare. And what about the rehabilitation? Do you learn some rehab?
Yeah, I learned, and we
You got the PPT?
a lecture. Okay.
You got the lecture?
Yeah.
Take the lecture of ACL rehabilitation or whatever rehab you need. Even in future, you want something, you have the number, right?
Okay.
You want to discuss some case, you want to learn about the rehabilitation.
Yes.
Like you have done this surgery, what rehabilitation should we do? If you can't have a team for do it, we can do from here online so that to increase the results of your patients.
Thank you. And I will come back another time.
Yeah, come anytime.
In the future. My friend, I want to advise him to come here and to see your technique, new techniques, and your experience, operation. And I hope the fantastic experience.
Generally, these type of surgeries doesn't happen in India.
Okay, you're welcome.
So you have to go to US or UK for these surgeries, but hopefully we are showing you. What I want to say to you that for ACL, what you can do basic is that start doing LET in every cases and just focus on rehabilitation of chondromalacia patelli, patellar maltracking and ACL both.
Yes.
In every surgery, patella is going to maltrack. It's important to address that thing and get the rehab schedule from here. The total they have given you the schedule, rehab schedule. What to do with the ACL with the weeks, what to do with the chondromalacia patelli, patellar maltracking.
Okay.
You can tell your physiotherapists to follow the same.
Okay.
And if they have any doubt, they can always contact us and we'll help you out.
Thank you.